What's up, guys? This is Men's Health Network, and today we're talking about predatory policies in men's health. In the last 100 years, we made a lot of progress in the way we talk about and understand physical and mental health. As a society, we've definitely come a long way from the days of superstitious beliefs and reusing syringes. But that doesn't mean our healthcare system is perfect. We all have concerns, and sometimes our healthcare providers get it wrong. That's why it's important to be able to point out and recognize predatory health policies. These are practices within the healthcare system that exploit vulnerabilities, causing financial harm and resulting in ineffective care. They can be found in different areas and use different tactics to take advantage of men seeking care. Being informed of these policies empowers you to take control of your healthcare and advocate for your friends and family. The World Health Organization defines gender inequality as differences between men and women which systematically empower one group to the detriment of the other. Most of us are familiar with this definition when it comes to the disadvantages women face in society. But gender inequalities affect men too. Policymakers often hold negative attitudes about men or neglect to focus on men's health needs. Some assume that men aren't interested in their health, leading to dismissed concerns and decreased support. Even when men do seek help, they can be left in the dark by insurance companies. Many insurance products exploit loopholes in national policies. This can discriminate against patients with pre-existing conditions like diabetes and asthma. Some insurance plans can remove coverage after men become sick, refusing to cover basic care or charging them higher premiums to continue coverage. Needless to say, these predatory actions can cause major problems for men in the long run. The consequences of predatory and ineffective healthcare policies affect men in multiple ways. Let's take a look at the data. On average, the life expectancy of men in the United States is about 6 years less than women. Low-income men are less likely to have insurance than low-income women. In several states, men without children cannot enroll in Medicaid even if they have no income. Other states require income way below the federal poverty line. Men are also more likely to work in jobs without employer-sponsored health insurance. These jobs tend to be more physically demanding and dangerous, causing health problems later in life. The National Institute of Health even talks about the hidden costs of neglecting men's health, especially in men who are incarcerated. Incarcerated men often receive inadequate treatment or are totally excluded from treatment for mental health, substance abuse, and chronic conditions. Evidence shows that when men are neglected, there are real consequences on all levels. You may be asking yourself, what's being done to fight these policies and their effects? The answer is pretty optimistic. In 2014, the World Health Organization made a commitment to addressing the impacts of gender on men's health and involving men in achieving gender equity. Community-based initiatives are training medical professionals to talk to men about their health concerns and directing them to the appropriate services, normalizing seeking help. Programs like the Young Black Men Project help young men find educational and social support that can improve their understanding of mental health. In the long term, an effective strategy to combat these predatory policies would improve men's health literacy and challenge the gender norms that influence policymakers. That wraps up our deep dive into predatory health policies targeting men. We've explored how these practices cause significant financial harm and result in ineffective care for men across the board. We've also explored how negative perceptions can lead to the neglect of men's health care. These consequences are real, and you may have even felt them yourselves. From shorter life expectancy to disparities in insurance coverage and even diminished attention for incarcerated men. But there is good news. There are efforts being made on the community, national, and international levels to fight these challenges. Organizations like the World Health Organization are making a commitment to better address men's health. Programs like the Young Black Men Project are also dedicated to making a difference. Remember, being informed about these practices can empower you to take control of your health and advocate for those you care about. For more information, be sure to check out our website at menshealthnetwork.org. Men's Health Network out.